other parts of the body could
Yeah,
affect?
you have small joints of the hand, like, the proximal interphalangeal joints of the hand.
That's the fingers?
Yeah, the fingers. Then you can have the wrist, the hip, the knee, even the spine.
Why would somebody be getting osteoarthritis in the wrist? It's not like you...
Okay, there are risk factors.
Press it down or anything.
No, there are risk factors. Sometimes you might have a situation where there's an abnormal development of a joint, from birth. Okay. So where you have abnormal development of that joint, that is called dysplasia. So that will make that joint prone to osteoarthritis. Other things, trauma, where you have small trauma or light trauma, where there's injury to that joint, then the joint now would have susceptibility to developing an abnormality, and then, of course, the relationship of the bones that form the joint will now become arthritic as a result of the instability. Obesity, and you mentioned that women are most affected. Yeah, because you find that most of our women, with due respect, are bigger, and then you have smaller limbs and all that. So you find that the load, especially on the weight, and then you find that actually most of our women are very hardworking. And so the more you use your joints, especially the hand and all that, you may have injury, and then you are prone to arthritis. Age. Oh. Okay, so age is also there. Yeah, and then don't forget also the fact that there's some people, it runs in some families, so you might have some genetic factors.
When you talk about age, is it because the fluid and the cartilage is it because of wear and tear?
Exactly.
Or because of not producing something?
No, it's a combination of all factors, but wear and tear is as you grow older, systems, out of wear and tear would age, and then the joints are not exclusive, so you expect that with that happening, you expect damage to the cartilages, like I mentioned. But you do have those risk factors I mentioned. They're all at interplay. For instance, also suggest some job. Some people, the nature of the occupation.
Yes.
If you're working, you have a
vibratory
force. Yeah, exactly. So you find that you have such injuries to the limb. Arthritis, osteoarthritis is not common in some joints. It's not as if they're exclusive.
Yes.
For instance, the ankle and the shoulder. It's not as if they are not, but they are commonly not. You find osteoarthritis not commonly in those joints.
But more in the knee?
The knee, the hip, the wrist, hand, spine. No joint is exclusive.
There's arthritis of the spine too?
Oh, yes. That's the one they call spondylosis.
Okay.
Yes. So use the word, you have osteoarthritis of the spine, we use the word spondylosis.
Okay.
So you can have cervical spondylosis, lumbar spondylosis, thoracolumbar spondylosis.
And all this comes with a lot of pain.
Exactly.
People have said that they feel more pain in colder weather. Is there any reason for that?
I wouldn't, well, that's a subjective feeling, but it's a possibility. But all I know with the weight-bearing joints and arthritis, those were climbing stairs. You find that, when you're coming down or you're going up the stairs, you bear weight, you find the tendency for you to have more pain. Where also you have some twisting pain, or you are, so in other words, what we're saying is that with more activity, the pain is worse. With rest, you expect the pain to reduce.
To lessen.
Yeah, so yes.
So with this arthritis now, what can it be prevented?
Yeah, yes, well, we're not, for the purpose of this program, we can't go into deep details
about
about the different types. But people say primary and there's secondary.
Okay.
But anyway, but if you are obese, if you are told to lose weight, so that the load or whatever joint.
Okay, that's a very practical thing to do.
Growing old is not. I can't say you shouldn't grow old, because that's a natural process.
That's non-modifiable.
Exactly. But. If you are a sportsman, the tendency for you to have injuries to your joint is high. So if you're a sportsman, you need to also work hard to prevent injuries, if it's possible.
So would it be right to say then that sports people are more prone to having osteoarthritis, because they come down with all sorts of things? Hamstring today, hamstring the next 6 months.
Yes, I can say they are prone, but they also are professionals, so they have the ability to prevent injuries. But when you have injuries to the joint, the tendency is that if it's not properly managed, then you have a situation that you can develop arthritis earlier,
Okay.
right, than the natural process.
Is it life-threatening? I need to get that first.
Well, I don't. Osteoarthritis is not life-threatening. In other words, if you have a situation that your joint is degenerative and you can manage it, but if the secondary factor leading to, for instance, if it's an infection and you don't treat the infection, it is expected that that could lead to a life-threatening situation. But the natural history of osteoarthritis is not life-threatening.
Okay, since you talk of, osteoarthritis from a primary source, maybe an infection or something like that, is it possible that somebody may be diagnosed with osteoarthritis and then after a while it goes when the causative factor has been handled?
Well, that's a good question. If you had an infective process that has damaged the cartilage, if the cartilage damage is little, then there are things you can do. First of all, eradicate the infection, stabilize the joint, and then encourage the treatment modalities that you give. If the infective process is not eradicated,